Hey, Polly.
Hey Greg, how are you?
Doing all right. It's that time again.
Who's on the podcast today?
Today we have BHDDH's Associate Administrator, Elizabeth Farrar. So,
Oh,
I've seen the emails, I've seen her in meetings, and we finally have got her on the podcast.
is this a result of her sitting next to you at lunch at Kanka?
I'm not gonna say I didn't blackmail her into, I'm not gonna say I didn't, twist it a little bit, but yeah. But we don't need to talk about that.
Was there a piece of chicken involved in
We,
this?
we will not talk about that. I can neither confirm or deny, but she is here and she's going to let us know about all the workings of BHDH and that prevention wing over there.
All right.
All right. So without further ado, joining us on Totally Preventable, we have Elizabeth Farrar, the Associate Administrator at BHDDH. Elizabeth, how are you doing today?
I'm doing great, Greg. Thank you. Thank you so much for asking. And hi, Polly.
Hi, how are you?
Good.
So this is awesome. I've been waiting to get BHDDH on Totally Preventable, and finally we have you, the one and only. So can you start by telling us a little bit about yourself and how you got to where you are today?
Sure. Well, I've been at BHDDH for 22 years, and I've overseen prevention for maybe about 12 of those years. I do have a clinical background. So when I started BHDDH, I was in the treatment unit. So I was a clinician for a long time. And I also have some recovery background, both personally and professionally. I was the first director for Rhode Island Cares, Rhode Island Communities for Addiction Recovery Efforts. So I have kind of across the continuum, prevention, treatment, recovery.
Wow. Thank you for sharing.
Nice.
Oh, you're welcome.
Could you tell us what the core mission of BHDDH's prevention unit is, and how does it align with statewide effort?
Absolutely. Well, the prevention unit itself doesn't have a written mission per se, but I will talk a little bit about the BHDDH mission, if that's okay. So the Rhode Island Department of Behavioral Health Care, Developmental Disabilities and Hospitals, we are the second largest department in the state, and we have over 1,200 employees working in 4 divisions. We have the Behavioral Health Division, which is where I work, and then we have developmental disabilities, forensics, and the state hospitals, which are Eleanor Slater Hospital in Cranston, and then we have one also in Barrowville. BHDDH provides services to over 50,000 Rhode Islanders and their loved ones who are living with mental illness and or substance use conditions, as well as developmental disabilities and a need for long-term acute care in one of our state hospitals. And we administer funds which support a statewide network of prevention and mental health promotion initiatives. And the mission for BHDDH is to ensure equitable access to high quality, person-centered, and safe services for individuals who have differing intellectual, developmental disabilities, mental health, substance use disorders, or in the care of our state facilities. And then our vision is to ensure a future where all Rhode Islanders with behavioral health and intellectual developmental disabilities live and thrive inclusively in supportive communities and have access to quality rehabilitative outpatient hospital level care when necessary. And our values are, we have a set of core values which embody in the state's motto, HOPE, which is promoting and inspiring hope for good health, a safe home, a supportive community, and living a purposeful life. These 4 pillars support the department's foundational values of dignity, respect, person-centered choice, and accountability.
Wow. I did not know that BHDDH was broken up into 4 different quadrants like that.
Now I'm very curious about forensics.
Yes.
I don't know a lot about that, but yeah.
We've met some other people from BHDDH, and I was just surprised because I feel like we've been dealing with BHDDH for so long and we know the people, but we only know a certain amount of people. There's so many other things going on that we don't know about.
Absolutely.
The hospitals is really, I didn't know that the hospitals were involved with BHDDH. I feel like I should know, but I didn't know.
Yeah,
Don't tell.
okay.
Now you do.
Now I know. So how do the 7 regional prevention task forces operate, and what roles do they play in tailoring prevention strategies to the unique needs of Rhode Island's communities?
Great question. BHDDH currently funds 7 regional coalitions across the state. This is relatively new in its development. New to me is, almost 10 years. Prior to that, we did have municipal coalitions exclusively. We had, out of the 39 municipalities, I think we had 38 municipal coalitions. And part of what we wanted to do is to have a stronger statewide footprint for prevention. So we did regionalize about 9 years ago. So we do fund 7 regions, and we promote comprehensive community prevention programming by having a local needs assessment performed, and that's done about every 3 to 4 years. Planning and implementation of evidence-based programs, and then evaluation of these strategies, policies, and programs to produce long-term reduction of substance use and wellness promotion across the lifespan. So the regional coalitions, as I mentioned, that's on the newer end of things. They have a primary goal of reducing the misuse of alcohol, tobacco, and other drugs among Rhode Island cities and towns through that use of evidence-based policies, practices, and programs. And the regional coalitions are a cohesive group of individuals dedicated to educating and providing resources to the community about evidence-based prevention skills and the importance of healthy lifestyle choices. So as I mentioned, the regionalization has created a stronger statewide footprint for prevention of substance misuse and promotion of wellness. And our regional coalitions have done great prevention work that primarily targeted middle and high school age students and communities. But through additional funding from the opioid stewardship and the state opioid response grant dollars, we've had the opportunity to expand to additional populations that include preschool, early elementary age children, the BIPOC and Latinx communities, and older adult populations.
Just learning so much today. I feel like I need a tour of BHDDH now.
Oh, you're welcome to.
All right.
We have a lot of buildings.
I feel like we used to be there all the time. I guess before we regionalized, we were there all the time.
Yes.
I remember it being very hot. It was like one of those buildings.
Oh, you know me and he.
Either on or off, right?
Yeah, it's changed. It's changed. We've had some we've revitalized our buildings, and it's the opposite now. It's chilly. So the air conditioner is very strong, and then the heat is not so much.
I will not be visiting them.
No, there's no heat that stays away.
Well, not no heat, but it's not as warm as I would be comfortable.
Could you tell us a little bit about Rhode Island Student Assistance Services, particularly their project success and how it addresses early intervention in the schools?
Yeah, absolutely. Student assistance is their program is an early identification and referral program for middle and high school students. So we have master's level student assistance counselors deliver the evidence-based program called Project Success. And that's implemented currently in 32 districts, 2 technical schools, which include, for the districts, it includes 20 high schools and 27 middle schools. So we aren't in all, but we're getting really close to that. And sometimes funding plays a part, that we don't have enough funding to do everything we'd like. But the goals of student assistance program and Project Success are to enhance the resiliency of adolescents whose parents have a substance use condition, to delay adolescents' initial use of alcohol, tobacco, and other drugs, and to decrease adolescents' use of alcohol, tobacco, and other drugs. A valuable feature of Project Success is its ability to identify and help youth, especially those at high risk, before the onset of alcohol and other drug problems. So this early detection and intervention has proven very effective in delaying initiation of the use of alcohol and other drugs and reducing school life problems, for those adolescents. And some examples of activities performed by the student assistance counselors include prevention education sessions, short-term individual and group counseling, different groups that are specific for children of alcoholics, newcomer groups, so newcomers to a school, recovery groups for those students who might be in recovery from their substance misuse addiction. And then we also have a parent program where schools work with the student assistance counselors for their parent-teacher organization meetings, as well as parent-teacher conferences, and then student orientation.
Wow.
So it's before the onset of a diagnosable disorder, so that makes it fall within primary prevention.
That is awesome. Now, how does the biennial Rhode Island Student Survey BHDDH's prevention strategies? And have you seen any trends emerge regarding youth substance misuse or mental health?
Yeah, absolutely. That's a great question. So we do make data-driven decision-making, where we have the Rhode Island Student Survey, which is a collaboration among the Rhode Island Department of Behavioral Healthcare, Developmental Disabilities and Hospitals, that's us, BHDDH, Department of Health, and Department of Education. So we collaborate with those other state agencies to administer the survey. So as you mentioned, the survey is administered every other year, and it's one of 3 state agency surveys that are administered. The other surveys include the Youth Risk Behavior Survey, which is administered by Department of Health, and that's on the off year of the Rhode Island Student Survey. And we did that was planned. We worked with them to have it on the off year. Otherwise, we kind of inundate schools with these surveys, and there's survey fatigue that can happen. And then there's a survey that's done by Department of Education, and that's done every year. But unfortunately, it doesn't have questions around substance misuse and mental health indicators. So that's more of a overall survey that asks about use of bike helmet safety, nutrition, a lot of very relevant questions, but not that we would be able to incorporate in our work. So the Rhode Island Student Survey is a risk and prevalence survey for youth and middle and high schools within Rhode Island. And a risk and prevalence survey looks at a set of factors or conditions to which youth may be exposed that are associated with negative behavioral health outcomes, as well as the extent of which youth may report engaging in problem behavior. The Rhode Island Student Survey explores substance use, bullying, depression, suicide, and violence. The intention and purpose of the Rhode Island Student Survey is to identify areas where there are strengths that can be built upon to put additional resources to those areas that need improvement. There are other surveys administered in schools that I mentioned, but most do not allow for the ability to analyze data at the school, district, community level. And this data is crucial for planning and evaluating prevention services, especially when resources are so scarce. It's imperative to have community level data to apply for and receive federal funds. Mm-hmm. Some trends that we've seen when we look at the results of the 2024 Rhode Island Student Survey compared to 2022 are that we've had a significant increase in past 30-day marijuana use among middle school students. So that's kind of the bad news. The other part of that bad news is that we've had significant increases in bullying and cyberbullying among middle school students. So those are 2 areas that we need to take a look at our strategic plan, what activities are regional coalitions going to implement with the assistance of student assistance counselors. But the good news is that we've seen significant decreases in past 30-day use of electronic nicotine delivery systems, so ENDS products, and alcohol among middle school students. We've seen significant decreases in past 30-day use of marijuana, both smoke or vape, alcohol, ENDS, cigarettes, prescription medications among high school students. We've seen significant decreases in ever use of alcohol, marijuana, and ends among high school students. Significant decreases in ease of access of ends, marijuana, alcohol, cigarettes, and prescription drugs among high school students. Significant decreases in percent of high school students who have ever driven or been a passenger in a vehicle driven by someone under the influence of marijuana. Significant increase in perceived parental disapproval of marijuana among high school students. Significant increases in perceived peer disapproval of use of prescription drugs, tobacco, alcohol, ends, and marijuana among high school students. Significant increases in perception of risk of harm with the use of ends, alcohol, and marijuana among high school students. So those are some we see when perceived risk of harm goes up, we see use of substances go down. So those are great indicators here. And then around mental health, we've seen significant decreases in feelings of sadness or hopelessness among all students. Significant decrease in numbers of students who have seriously considered attempting suicide. And then significant decrease in number of high school students who have ever attempted suicide. So those are a few. I know I threw a lot of numbers at you, but the overall picture is that we are making great progress, and this is directly related to the work of our prevention programs, both our regional prevention coalitions, our municipal prevention coalitions, and our student assistance counselor program. So those are some great trends that we're seeing in our data.
And if someone was listening and is interested on all those data points, but just couldn't comprehend them all because they were driving or whatever, is there a dashboard where they can go and see that? I'm not sure it's called a dashboard, but
yes, there is. We actually have a dashboard, and I can put it in the chat, but it's a dashboard that State Epidemiological Outcomes Work Group, also known as the SEOW, and we have a dashboard that lists the Rhode Island Student Survey, and we have reports that can be run based on substance use, mental health, suicide, and other measures, and it can be run at both the regional level. Schools have their own code to access school level reports, and then we also have community level reports. So I'll put that in the chat that you could share with your listeners. And that way they have that. I know it's, and don't do this while you're driving, but certainly take a look at it. Feel free to. And yeah, we're happy that these dashboards were completed and finalized for public viewing.
yeah,
It is great, all of the decreases and all the improvements that you see. It's just, seems like you can never take a break because you see
Something
all
else.
that, all the decreasing
Yeah.
things like the vaping and the e-cigs and everything, but then you see middle school bullying is up. It's just like, you get your hand on something, you get a grasp on it, and then something else comes up.
Yeah.
Yeah, there's so many emerging products that we, have to stay educated on. And then also, it's an innovative group, our younger generations have access to things that maybe we didn't have. And then through social media, this promotion of some of these practices that aren't very healthy for our young people.
That's right.
Yeah. So the Rhode Island Youth Adult Survey, can you tell us the significance of it in understanding its substance use patterns among individuals ages 18 to 25, and how that data influences prevention and how you find those people? Because I would think that is a hard population to wrangle up, because they're not necessarily in a place where we can really convince them to take a survey.
Absolutely. Yeah, I'm happy to talk about it. So the Rhode Island Young Adult Survey is a behavioral survey administered to adults ages 18 to 25. They have to reside in Rhode Island for at least part of the year. So that gives us access to maybe students who are just here during school and maybe they live in another state the rest of the year. Our survey is offered in English, and it's funded by the Substance Abuse and Mental Health Services Administration, SAMHSA, and it's through a discretionary grant, Partnerships for Success, that was awarded to BHDDH. And the young adult survey is very important because, as you mentioned, Polly, it is a group of individuals that we don't have direct access to a captured audience like we do with middle and high school students. They're in school. We can have, school personnel assist in the administration. So this is a little trickier, but very important because we do see some of the riskiest behaviors in terms of substance use, and there tends to be a higher rate of mental health issues. Young adulthood is also a developmental transition period in which long-term health outcomes and long-term behaviors are established. So it's even more important we reach these individuals. So the Young Adult Survey is the largest behavioral survey to date for young adults residing in Rhode Island, as I mentioned, for at least part of the year. So this includes visiting college students. Unlike other surveillance systems, we don't necessarily capture those who aren't full-time in our state. So this has been a great opportunity. So prior behavioral estimates from this population have used a much smaller sample for annual surveillance, such as the Behavioral Risk Factor Surveillance System, which is a survey that's administered by the Department of Health. And how we use the data is that the Young Adult Survey provides a snapshot of the state of substance use and mental health issues among the young adults residing in Rhode Island. It helps guide policy and programming related to young adults, problematic substance use, risk and protective factors for substance use consequences, the mental health burden, adverse childhood experiences. Findings provide insights that, when combined with context and other data sources, can be used to help in our decision-making about types of resources and where prevention resources should be allocated. The way we've had success in onboarding 1,100 young adults to participate in the survey is to go through social media, because that's where they are. And it's not Facebook, because that's considered for older people. It's Snapchat, Instagram, other types of social media platforms, and we've incentivized it. In this particular case, we've been allowed to incentivize through the federal funder by giving a small Amazon gift card for completing participation. And I don't have the final data. I know it was presented recently at a meeting, but the report hasn't been finalized. So I'd be hesitant to present it here, but I'd certainly welcome being asked back, either having Karen Flora from the Partnership for Success grant present it, or Sam Rosenthal. Dr. Rosenthal was the one who administered the survey and is cleaning and analyzing the data as we speak. So I think that could be a part two to this totally preventable podcast.
Right. I like that. We'll keep that note for more. So how much did your street cred and your cool level go up when you started doing the Snapchats and Instagram reels or whatever else to recruit? Did you go way up?
I think it did. I think that we're meeting people where they're at, and we have to be aware of the trends, and we have to be aware of the context for which the questions are asked. We want to make sure we have the proper name usage. So we usually, in all of our surveys, we have, for example, cannabis, but then we also have, street names that are used for cannabis, and we try to stay in the know for what those are, like weed and pot, and more relevant terms that are used for these age groups. So I think that helps with our credibility when we have a survey that we're using kind of current language and then current mechanisms to reach individuals. It goes a long way.
Like a full-time job trying to keep up with all the terminology.
I know. I had an intern once, a prevention fellow, actually, Dan Fitzgerald, who's fantastic, who might want to be included in one of these totally preventable podcasts. but he was a prevention fellow, and he updated what we call the slang guide to words that are used, so that we do kind of stay credible in that way.
Right.
I think Dan was
Yeah, he was like 3 or 4.
season 1.
Yeah.
Yeah.
Oh, okay. So you already got him.
Yeah, we jumped.
Fantastic.
He might be good to have him back.
Yeah.
Yeah, he can talk about his dog Walter, who has a very big
Ah,
internet presence.
he actually won Westerly's or second. I think he came in second for Westerly's favorite dog. So there was a recent contest for Walter. I voted for him.
We're putting all Dan's business out there.
Walter. Heck with Dan, just Walter.
Yes,
Yeah.
such an adorable dog.
Yes.
Now, how does BHDDH's 5-year strategic prevention plan aim to strengthen the infrastructure, the support at both state and community levels to reduce substance misuse among our youth and young adults?
Great question. We're in the process of revising that current strategic plan. So it's usually a 5-year plan, as you mentioned, and we utilize a lifespan approach to prevention. We utilize risk and protective factor model that aligns with needs assessment and strategic plans. The strategic prevention framework is the core operational planning framework that we use. And that includes doing a needs assessment, weaving cultural competency into everything we do, being able to evaluate if these strategies have been appropriate and having an effect to behavior change. And then we go back and review those needs assessment strategic plans and make revisions based on new data, as I just mentioned about the risk data and the young adult survey data. We also utilize the IOM, which is the Institute of Medicine Continuum, that has a nice little graphic that shows where prevention falls on the continuum. So we have promotion, prevention, treatment, and recovery, and prevention's kind of in the middle as to where we fall in that continuum. So that guides a lot of what we do. We use 2 primary structures that I already spoke of for implementation of primary prevention services. That includes student assistance services and the regional and municipal prevention coalitions. We still aim to achieve all 6 Center for Substance Abuse Prevention strategies in accordance with the state's primary funder of substance use and mental health services, which I mentioned before is the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. And they might be great to include for the Totally Preventable podcast someday.
Right.
So these 6 strategies are information dissemination, education, alternatives, problem identification and referral, community-based process, and environmental strategies. And the way we cover these strategies will likely change as we collaborate differently with new and existing partners. But we currently work with Rhode Island Student Assistance Services, as well as the regional and municipal prevention coalitions. We do have some changes, as I mentioned, for the upcoming strategic plan for 2025, where we will have state youth treatment implementation, ESPERT, which is a screening and brief intervention referral treatment program. And then we have this new funding that's opioid settlement, opioid stewardship. So how do we incorporate that into our current work? So that's not always guaranteed funding. We have some opiate settlement dollars over a time span, but we do work with our Office of Health and Human Services, which is the overarching entity for most state departments. We align our vision with SAMHSA. So SAMHSA has 5 priority areas, and that's preventing substance use and overdose, enhancing access to suicide prevention and mental health services, promoting resilience and emotional health for children, youth, and families, integrating behavioral health and physical health, and then strengthening the behavioral health workforce. So you might know, as part of that workforce, that people are leaving the behavioral health workforce You know, there's a lot of stress in the work that we do. It doesn't always have the highest paying salaries. So we're just looking at how we can continue to strengthen the workforce.
And that's going to go right into my next question about challenges with BHD in the workforce, and what initiatives you might have in place for recruitment, retainment, and training qualified professionals. I mean, I know here it seems to ebb and flow. Sometimes we have tons of positions open, and currently we are a full house. So do you have any tips? What are you guys doing there?
Yeah, that's such a great question. I just want to make a plug for Newport County. I feel like you have such a great team, and you've really incorporated younger people, and really it's just I got to know you at a federal conference in February, and know you better. And it really, you just have an excellent team. I'm very impressed with the ideas and just the passion and commitment of the Newport County Prevention Coalition as a region, but then all of the cities and towns within there. That really just very impressive.
You should have
Just
said
wanted to
this on
mention
day one and not the last day. We were even more.
that. I know, it was a busy conference.
Yeah.
But so, yeah, we definitely have challenges BHDDH is facing, as well as, you know, as a whole, I think the state and really the nation. So one of the greatest challenges in substance use prevention field, as well as nationally, as I said, is the recruitment of new employees, the retention of current ones, as our workforce ages into retirement or people change careers. BHDDH is dedicated to the recruitment, retention, education, and training of substance use treatment and professional prevention professionals to improving the quality of our workforce. We have valued partnerships that support the development and implementation of new initiatives to support workforce development. And Rhode Island's prevention programs ensure that communities can achieve the best possible behavioral health outcomes and encourage engagement, inclusion, and shared responsibility. So as the behavioral health field faces challenges retaining their workforce across the continuum due to competitive salaries elsewhere, as well as people facing burnout, the prevention workforce, one of the initiatives that I advocated for is through COVID-19 dollars a few years ago, is to offer a one-time recruitment and retainment incentive to our prevention coalitions at the municipal level, as well as the regional level, and student assistance counselors. So we did offer some incentives, one-time incentives at that point through COVID-19 dollars that were temporary, unfortunately went away. So that isn't an option now, but it was something that that I advocated for. Another recruitment strategy that we've done in the past is we've provided presentations through higher education on prevention as a career opportunity. And I've been one of those presenters at University of Rhode Island. And it was really eye-opening to the individuals in the classroom, the students at the higher education level, because they hadn't ever heard of prevention. And I went through the certification, the comprehensive certification process, which I'll talk a little bit more later on, and just different opportunities that they hadn't ever heard of. And they're working in, you know, either psychology, working through a degree in psychology or behavioral health, social sciences, and it really was a great opportunity to discuss that. We plan to revitalize this collaboration with our Prevention Training and Technical Assistance Center, the Rhode Island Prevention Resource Center. That's something that we've spoken about revitalizing. With COVID, we did have to kind of put a pin in it until we were having in-person education at that level again. We also offer training through the Rhode Island Prevention Resource Center and through the Prevention Technology Transfer Center, which is funded through the federal entity of the Substance Use and Mental Health Services Administration, SAMHSA. We also offer e-learning courses, webinars, in-person events, and we developed a prevention certification study guide to assist in the preparation of certification that's used locally as well as nationally. So that was something I saw when I had a prevention fellow, that there was a need to develop a study guide for certification for professionals, because there's a lot of intricate pieces to it. And there's 3 levels of certification for prevention specialist. The first is the associate prevention specialist. The next is the certified prevention specialist. And the last is the advanced prevention specialist. So these certifications have helped to professionalize the prevention field for Rhode Island and nationally.
We had one of our coordinators got invited to a career fair not that long ago. So she did a whole flyer, like maybe it was a big postcard about prevention work, because she had gone to URI for public health and had no idea that prevention was available and tied in, and is thriving here and loves the way her view of public health fits into prevention and youth. So yeah, I think maybe high school students need to know too that prevention is an option, you know, like when they're picking out their career.
Yeah, that's a great point. I feel like it's just not well known. And one other initiative that we're doing is I recently collaborated with the Recovery Friendly Workplace, which we have staff here who manage those contracts. And we currently have 175 recovery friendly workplaces. And I'm going to be presenting at a monthly webinar that they have to talk a little bit about prevention, and maybe not as a field of interest, but what we have to offer for programs such as the lock bags, drug take back events, the social host laws. But I could put a little information in there about, if you want to know more about the prevention field, you can contact me. I just don't want to look like I'm scooping their employees from them. They might not invite me back.
I can understand that one.
And that number is going to be 176. We're getting trained next week.
Nice.
I think we have like our honorary certificate from originally when you could become a recovery friendly, but we're going for the we're getting trained.
So you're one of the first, probably.
Right. We want to really earn that certificate.
So Elizabeth, you just named a few, like the Locks Box and Drug Take Back Day, but can you talk about some other community-based prevention campaigns that have been successful in Rhode Island?
Sure, absolutely. We've had the Road Rules, which is a social host campaign that aims to educate Rhode Islanders about the law of not purchasing alcohol and then hosting an event in your home to underage Rhode Islanders, and to prevent people from buying and providing alcohol to minors. That's one really successful campaign that we've had. Then we have Talk They Hear You, which is a substance prevention campaign that SAMHSA created to educate and encourage parents and caretakers to begin talking with their children early on about the dangers of alcohol and other substances. So that campaign aims to reduce underage drinking for youth under the age of 21 by giving parents the confidence and tools to start the conversation about drugs and alcohol. And it's actually SAMHSA, which is our Substance Abuse Mental Health Services Administration. They have a website that provides many resources for parents and caretakers on how to start talking to their children about alcohol and other substances. We also have the drug take-back events that we've mentioned. Those happen twice a year, where communities can drop off unwanted or unused medication to be disposed of. We have over-the-counter, not on-the-counter, in collaboration with the lock bags for both prescription drug medications and cannabis. And it was an unintentional poisoning statewide campaign that several state departments collaborated on as an effort to educate parents not to leave prescription medication or over-the-counter medication on the counter, but to lock it away so children or young adults don't have access. We've had accidental poisonings from edible cannabis. We've had accidental poisonings from edible vitamins, supplements. So it's important to just not have those out because sometimes they're attractive if they look like candy in particular. Those are some of the highlighted campaigns that come to mind.
Thank you. Thank you for sharing.
Yeah, I know. My vitamin D pills or gummies, I could eat that whole jar in one sitting. I only have
Don't do it, Polly.
No, I won't. But I take two and I'm like, I wish I could have some more. So if
Yeah, they taste great, right?
Yeah.
They taste sweet and
Yeah.
look like candy.
They do. Absolutely. Looking ahead, what are BHDDH's goals for expanding and enhancing substance misuse prevention programs to address emerging challenges and ensure the well-being of all Rhode Islanders?
Well, that's a great question. We do develop a strategic plan every 5 years, and we really look to align prevention's vision to be in line with SAMHSA, the Substance Abuse and Mental Health Services Administration. And I mentioned a couple of those items earlier, but there are 4 core principles that SAMHSA has, and those are equity, trauma-informed approaches, recovery, and commitment to data and evidence. So I think for prevention in particular, all of those are important, but the last is of the most importance. So making data-driven decision-making, using evidence-based programs, using environmental strategies, such as the drug take-back days or compliance checks that we do at tobacco and alcohol retailers to ensure that they're not selling to underage folks. So we use the risk data, the Rhode Island Student Survey data, and the Young Adult Survey data. So that drives our decision-making of the areas that we need to focus on. We also want to make sure that we focus on priority areas for the Substance Abuse and Mental Health Services Administration around preventing substance use and overdose, enhancing access to suicide prevention and mental health services, promoting resilience and emotional health for children, youth, and families, integrating behavioral and physical health, and then, as I mentioned, strengthening the behavioral health workforce. So we review our progress annually with the Prevention Advisory Committee, which is a committee under the Governor's Council on Behavioral Health that has partners from across the continuum, prevention, treatment, recovery, also decision makers such as state representatives, local representatives, and the governor. So we have those decision makers around the table. And we have a bigger emphasis on evaluation. So we look at programs' effectiveness by implementing an evidence-based program to fidelity. And then we also look at what behavior changes are happening. What are the outcome data that we are showing changes from the Rhode Island Student Survey and the Young Adult Survey across years. So we look at what the trends are. And then what we're doing with evaluation is we had previously had this as an external evaluator, and now we're bringing that in-house with our internal epidemiologist team. So evaluation will be closer to implementing of the services in prevention.
Wow. I have been to BHDDH a couple times, and everyone is always smiling, happy. Just, it's a nice free flowing place. Had I known that all this is going on behind the scenes, this is the work they're doing to put on that smile, that happy face. Hey, how's it going? As if nothing, nothing's troubling you. This is amazing work that you're doing. I just can't say it enough. I'm so happy to be affiliated with BHDDH and all of the work that's being done. So great job. And thank you so much.
Well, thank you so much, Polly and Greg, for having me on the Totally Preventable podcast. I think it's an opportunity to talk a little bit more about the behind the scenes work that goes into it, and that prevention is a science, and that we're using programs that have been created by developers and have evaluation components. We look at the progress that we've made, and then we make changes accordingly.
This is great. For anyone who's looking to find out more information about BHDDH, where can they go? What's the best way to find that?
Well, we do have a website, and I'll provide that to you here. So we're at bhddh.ri.gov, And I'll put that in the chat so you have that. But we do have different elements to the website that you can look at prevention specifically. You can look at mental health, about us, and you can also find a provider that you might need to access, whether it's a student assistance counselor in a school. We have their contact information and what school they're in, or we have treatment providers that you might be able to access your behavioral health treatment through that. But we are here and available. My contact information I'll also provide in the chat that people can contact me directly. Probably email is best. That way I can kind of get back. I see my email pop up on my phone even through the app. So it's, I think one of the things I say often to our providers is that we practice good self-care. So we do have to unplug at times. We have to end our day at a certain time. We have to, get outside and take good care of ourselves, because there is a lot of work to be done, and we just have to manage that, balance all of our life, our family, our hobbies, our work, our beliefs, our ways to connect to a higher power. So I think there's a lot of different aspects to our lives that we have to keep balanced.
All right. Thank you so much. This has been great.
Yeah, thank you, Elizabeth. It's been great chatting with you.
Thanks so much for having me. And let me know if you ever want part 2 from one of my other colleagues here at BHDDH. That would love to be a part of the Totally Preventable podcast.
Right. Remember you said that. So you have a great day.
Thank you.
Thank you. You too. Bye-bye now.